Top 3 vitamins every diabetic must take. When people think about managing diabetes, the focus usually falls on cutting carbs, taking medications, and keeping a close eye on blood sugar. And while those are definitely important steps, there's another crucial factor that often goes overlooked: nutrients, specifically the right vitamins. These vitamins are critical for keeping insulin functioning correctly, protecting nerves, and warding off severe complications. In reality, most people with diabetes are missing essential vitamins that directly affect not only blood sugar control, but also energy and organ health. If that shortage isn't fixed, it makes diabetes management harder than it needs to be. In this video, we'll go through the top 3 vitamins every diabetic needs in their toolkit. Constant fatigue, body aches, and difficulty controlling glucose can all be tied to deficiencies in these vitamins, so sorting them out can be a huge game changer. And trust me, you'll want to stay until the end, because I'll also tell you about the best food sources and supplements to ensure you're getting enough of these must-have nutrients every day. Let's get started. Number 1. Vitamin D. If you have diabetes, vitamin D might be a lot more significant than you think. It's not just about bone strength or immune support. It also substantially affects insulin function, inflammation management, nerve protection, and organ health. Unfortunately, many people with diabetes are prone to low vitamin D. This often happens because insulin resistance and chronic inflammation get in the way of your body's ability to use vitamin D properly. Elevated blood sugar plus more frequent urination can also flush vitamin D out of your system before it's fully utilized. On top of that, many folks with diabetes spend less time outdoors, meaning lower sun exposure, the main way we naturally produce vitamin D. Growing older complicates matters even more, as an aging pancreas and liver become less efficient at activating the vitamin D you do get. You can measure your vitamin D levels with a blood test called 25-hydroxy-vitamin D, but your body typically shows warning signals as well. Constant fatigue, muscle soreness, slower wound healing, nerve numbness, frequent infections, or brain fog might all hint that your vitamin D is too low. Some even develop sugar cravings, mood swings, or inflammation flare-ups. Low vitamin D can harm practically every system in your body. Fertility suffers in both men and women, libido can plummet, and nerve health declines since vitamin D helps protect and repair nerves. Kidneys are also affected, with a higher chance of kidney stones and chronic kidney disease. Vision might diminish too, as insufficient vitamin D can worsen retinopathy by allowing more inflammation in the retina's small blood vessels. The circulatory system also takes a hit if vitamin D remains low. Blood pressure can climb, arteries can stiffen, and the risk of heart attack or stroke can increase. But on a cellular level, vitamin D is indispensable for insulin sensitivity. It engages vitamin D receptors in pancreatic beta cells, aiding them in producing and releasing insulin more efficiently. It also lowers inflammatory cytokines that are persistently high in those with diabetes. And let's not forget, it helps regulate calcium movement inside cells, which is crucial for nerves, muscles, and glucose metabolism. Improving vitamin D levels can be done via natural foods like cod liver oil. 1 tablespoon has about 340% of your daily requirement. Wild salmon, 100 grams, gives around 113, and sardines, 100 grams canned with bones, have roughly 110%. 2 large egg yolks can offer 20%, while UV-exposed mushrooms, 100 grams, supply about 40%. If you enjoy gourmet meals, you could try Japanese miso-glazed salmon, 180 grams, for nearly 150% of your daily vitamin D, or Norwegian pan-seared cod liver, 80 grams, for an impressive 300%. Another choice is black truffle scrambled eggs with shiitake mushrooms, 2 eggs plus 50 grams of mushrooms, giving about 60%. If you still need more vitamin D, supplements can help. Nordic Naturals Vitamin D3, 1,000 to 5,000 IU, is known for its purity and good absorption, while Thorne Research Vitamin DK2, 5,000 IU, pairs vitamin D with vitamin K2 for optimal calcium regulation. Keep in mind that certain foods and behaviors can worsen vitamin D deficiency, like consuming lots of processed vegetable oils, increasing inflammation, or eating a lot of sugar, which speeds up magnesium depletion. Magnesium is vital for activating vitamin D. Excess alcohol damages the liver, where vitamin D is changed into its usable form. High phytate grains can also block vitamin D absorption. So addressing a vitamin D deficiency is about more than just taking a supplement. It's also about getting adequate sun, choosing nutrient-dense foods, and steering clear of habits that hinder vitamin D usage. Number 2. Vitamin B12. Now let's tackle vitamin B12. If you have diabetes, you're at higher risk for low B12, often without knowing it. The biggest culprit is metformin, a common medication that slows the body's ability to take in B12 from food. Over time, B12 stores drop, and high blood sugar itself damages the stomach lining, further limiting absorption. These problems worsen as we age, since older stomachs make less acid, and you actually need acid to free B12 from proteins in your meals. A B12 deficiency is sneaky because it looks like standard diabetes complications or just getting older. A major warning sign is nerve discomfort, tingling, numbness, or burning in your extremities. You might also be unusually fatigued or dizzy, which could be from the anemia B12 deficiency sometimes triggers. Brain fog, memory issues, and even mood changes can also appear when B12 is low. This deficiency can cause or worsen many health problems. Men can experience reduced testosterone and weaker sperm, while women can have abnormal cycles or decreased fertility. The nervous system often suffers greatly, as B12 is needed to protect nerves and facilitate nerve signal repair. Kidneys are also at increased risk, since B12 deficiency heightens inflammation and homocysteine, both harmful to kidney function. Eye health can deteriorate, leading to potential vision loss. And your heart and blood vessels are jeopardized because excess homocysteine, due to low B12, can lead to arterial damage, hypertension, and a larger likelihood of heart attacks or strokes. At a fundamental cellular level, B12 is crucial for energy, DNA synthesis, and nerve health. It interacts with folate to transform homocysteine into methionine, thereby lowering inflammation and bolstering vascular health. For diabetics, it's also indispensable for mending and shielding nerves from high glucose damage. Luckily, you can fix B12 levels through diet first, then supplements if necessary. Animal products are the major B12 sources. Beef liver, 100 grams, can provide 3-5 HUD of your daily need. Clams, 100 grams, nearly 4,000%. Sardines, 100 grams, about 350%, and salmon, 100 grams, 200%. Even 2 eggs can supply 25%. If you enjoy gourmet dining, French foie gras with truffle sauce, 150 grams, might deliver 2,000%, Japanese uni sashimi 100 grams, 3,000%, or lobster thermidor 200 grams, 1,500%. But not everyone eats these foods, so supplements are often required. Look for methylcobalamin forms rather than cyanocobalamin for better absorption. Jarrow formulas. Methyl B12 5000 mcg sublingual dissolves under the tongue, bypassing absorption hurdles in the gut. Thorne Research methylcobalamin 1000 mcg is another superior choice for assisting nerve repair and boosting energy. Remember, you'll want to avoid or reduce behaviors and foods that undermine B12 levels. Heavy alcohol use, refined grains, acid-reducing medications, and a diet high in sugary or processed items. If you sense numbness, memory lapses, or constant fatigue, your B12 levels might be to blame. Increasing B12, whether through diet or supplementation, can shield your nerves, fortify your heart, and raise your energy. If you have been enjoying these tips, don't forget to subscribe for even more content on how to manage diabetes with everyday foods. Number 3. Folate, vitamin B9. Lastly, let's look at folate, vitamin B9. This vitamin often gets overlooked in diabetic care, but it's indispensable. The body doesn't store folate, meaning you need it regularly from your diet or supplements. Sadly, diabetes makes it harder to absorb and utilize folate. Inflammation from high blood sugar disrupts folate metabolism, and medications like metformin block folate uptake in the intestines. Frequent urination exacerbates the shortage, flushing out water-soluble vitamins like folate, so your levels drop even more. Folate deficiency can also blend in with typical diabetes symptoms, fatigue, weakened muscles, slower healing, or brain fog, leading many to think it's just part of aging. Yet if it gets worse, you might develop anemia, feeling pale, dizzy, or breathless because your body isn't making enough healthy red blood cells. Without sufficient folate, your cells age faster and your body deals with more inflammation. Two burdens already heavy on diabetics. The deficiency harms fertility for both sexes, disturbs libido, since folate aids blood flow and hormone balance, and worsens nerve issues. The kidneys also strain because folate helps regulate homocysteine, an amino acid that can damage renal function if it's too high. Eye damage is another risk, as folate deficiency can worsen retinopathy through heightened inflammation. And the heart and circulatory system also pay a price. Elevated homocysteine can stiffen arteries, raise blood pressure, and heighten the odds of heart attack or stroke. At the cellular level, folate is fundamental for DNA repair, cell division, and controlling gene expression. For diabetics, it notably assists insulin sensitivity, decreasing inflammatory factors that degrade glucose regulation. It also keeps blood vessels more flexible. So how do you increase folate naturally? Focus on leafy greens, legumes, and organ meats. Beef liver, 100 grams, meets about 104% of your daily requirement. Spinach, 100 grams cooked, about 65. Lentils, 100 grams cooked, around 90%. Asparagus, 100 grams cooked, 35%, and a whole medium avocado, 25%. For gourmet lovers, consider duck liver pâté, 100 grams, giving nearly 200% of daily needs. An Italian truffle-infused risotto with asparagus and spinach, 200 grams, providing 120%, or a Japanese miso-marinated black cod with edamame puree, 180 grams, for 100%. If you can't get enough from meals alone, supplementation is an option. Look for methylfolate, which your body absorbs more readily than synthetic folic acid. Thorne Research 5 MTHF 1000 mcg is excellent. Pure Encapsulations Folate 800 mcg is another top-tier pick using methylfolate. Also, watch out for behaviors and foods depleting folate. Refined grains, excessive alcohol, high sugar intake, and certain medications hamper folate's absorption and function. Ultimately, if you're dealing with unexplained fatigue, nerve pain, memory glitches, or circulatory problems, ramping up your folate might bring major relief. It's a straightforward fix. Eat more folate-rich foods, pick the right supplements, and steer clear of things that block absorption. That way, you can protect your nerves, heart, and overall health despite diabetes. And here is a bonus tip for you. Check out the link in the description to watch a short free presentation about a natural way that can help lower your blood sugar. By now, you see that vitamins D, B12, and folate, B9, aren't just minor considerations. They're pivotal for anyone managing diabetes. If you've been grappling with constant fatigue, strange aches, nerve issues, or erratic blood sugar control, it's time to check if you're low in any of these vitamins. Improving your levels of D, B12, and folate can boost insulin effectiveness, reduce inflammation, rejuvenate nerves, and bolster heart health, all while upgrading your energy and daily comfort. Whether you add more vitamin-rich foods to your plate or consider quality supplements, you'll be taking a big step toward calmer glucose levels and healthier living. If you found this overview useful, please hit that like button and comment below about which vitamin resonates most with your concerns. And if you're serious about better health, don't forget to subscribe to catch more game-changing content on diabetes management. Thank you for tuning in, and I'll see you soon. Take care and stay healthy.